Hello everyone and welcome to Inside Healthcare. In this program we're going to talk about what you need to know to protect you and your loved ones from the Zika virus. And we're very pleased to have with us Dr. Jed Gorlin, Medical Director and Vice President of Quality and Regulatory Affairs with Memorial Blood Centers. So thank you, Dr. Gorlin, for being with us.
And thank you for having us.
So it seems like daily we're learning new information, different things about the virus. What do we know at this time about it? What are symptoms, who's at risk for it, things like that?
Well, we know lots about it. Most importantly for a Minnesota audience, there's not a lot of Zika in Minnesota. The mosquito that carries Zika, the Aedes aegypti mosquito, is a sort of a tropical mosquito. It likes the warm weather. And while it was warm this week, it's not warm enough for Aedes aegypti. That mosquito is, however, moving north, and it is in the southwestern United States. All Zika cases in the United States so far people have acquired elsewhere in the Caribbean, in Mexico, in Central and South America, particularly Brazil.
And we've been hearing a lot about Puerto Rico, what's going on with the Zika virus.
So there is more cases of Zika virus because it is a tropical mosquito. They expect actually up to 20% of people this summer in Puerto Rico will acquire Zika. For most people, it's a very mild flu-like infection with non-specific symptoms. And so there wasn't a lot of concern when Zika first appeared because it is so mild. However, two complications causing birth defects, which is obviously a very, very serious complication, and also an immune response called Guillain-Barré, which is much less common. So the major concern is women who are pregnant. If they acquire it, it can cause problems actually anywhere during the pregnancy.
Well, that would be scary. I think the World Health Organization just came out advising all pregnant women not to travel to the areas where the virus has been, in a lot of the Caribbean, Central America, South America, places like that, even Mexico.
So that's all well and good for travel, but what do we do when it comes to Florida or Texas where that same mosquito is? And that's a distinct possibility and one we need to anticipate.
And here in the upper Midwest, we have a lot of snowbirds that are going to the warmer places. We have spring breaks going on, coming up here, and so there's a real concern, I would think, for anyone traveling.
Just think, you might want to visit North Dakota.
I don't think that'll be on too many travel plans, but
well.
How does this impact blood donations and the blood supply here, especially in the United States, but here in the Minnesota area?
So it is fortunate that many of the places that are currently endemic with Zika, we are already deferring blood donors for a full year because of concern about malaria, which can lay dormant for extended time. Zika, you tend to get, and it disappears pretty fast. In fact, the longest known carriage of Zika in the blood is about 14 days. So we have, since February 1st, had a voluntary deferral if you have traveled to any of the countries, and we have a long list of where those places are. You're deferred for 28 days, which provides a good safety margin. We have now recently instituted actually formal questioning about travel to those areas, so there really shouldn't be any issues of transmission of Zika by blood. In fact, there have been hundreds of thousands of Zika cases in Brazil, and there may or may not be 2 transfusion transmission cases. So while we are doing things about transfusion transmission to prevent that problem from occurring here, it is actually a very low risk considering all the other ways there are to get Zika.
And as a longtime blood donor, I know that you are constantly revising all of that criteria, who can donate, when they can donate, and things like that. It's an ongoing issue, and that's kept our blood supply very safe.
We have the world's safest blood supply because we are so strict and have so many questions and so many tests. In fact, this fall we actually just added a test for Babesia, and Babesia is spread by the same tick that causes Lyme disease, and there is plenty of Babesia in Minnesota and the upper Midwest. And so we are actually screening all red cell donations for Babesia, and we think that will add even further to the safety of the blood supply.
Haven't heard much about that. Can you tell us a little bit more about that?
So the same tick, the deer tick that, or Ixodes, that spreads Lyme disease, also spreads anaplasmosis and babesia. From a number of clinical cases, there's a lot more Lyme disease than there is anaplasmosis, and there's more anaplasmosis than there is babesia. But for some reason, it's not easy to spread Lyme disease by blood. In fact, there's not clearly any cases of transmission of Lyme disease by blood. There are a few
It's
cases.
direct contact with ticks.
It's all those sneaky ticks jumping out at you, and in fact, the deer tick is so small that the vast majority of people that have been bit by those ticks have no idea. And it's babesia is asymptomatic in most people,
It is,
which is
so-
reason why you need to do a blood screen.
So, and that would pertain to being diagnosed as well as if you're a blood donor too, then having that screening.
Yeah, so I mean, many physicians aren't terribly aware of anaplasmosis and babesia, and so when they think about tick bites, they tend to think only of Lyme disease. But in fact, many ticks actually carry multiple different kinds of infection.
Are there other infections that you screen for on a regular basis as well?
So every donation, every time, is screened for hepatitis B and C, HIV, some uncommon diseases called HTLV. We screen every first-time donor for Trypanosoma cruzi that causes Chagas disease. In fact, our blood supply is incredibly safe, and less than 0.3% of all donations test positive, and most of those are false positives, just like going to the airport and having the metal detector go off. Most people on the metal detector aren't terrorists, and most positive tests on blood donation screening are also false positives.
It seems like we're always looking for more blood donors. The population, what, 30% are eligible and maybe less than 5% donate on a regular basis?
Well, we're incredibly fortunate that in Minnesota our women are strong, our men are good looking, and our blood donors are above average. So we actually have approached 6 or 7% of people donate regularly. Probably at least half of people have tried donating once, and it's not for everybody, we understand that. But we certainly do need people to donate regularly. That's the best way to have a safe and adequate blood supply. That said, we've done a wonderful job at reducing the use, so the blood supply is good now, but it's particularly important that we have blood donations around holidays, around challenging times, because blood is needed at all times. I actually wear 3 hats. I'm the blood center medical director, but I'm also the transfusion service director at Hennepin County Medical Center, which is the largest of the level 1 trauma centers, and Children's Hospital, and I can tell you a lot of the transfusions at Children's are for kids with cancer, and that knows no season.
Mm-hmm. So what do you say to people that are watching the show on why they should become a blood donor?
Well, in part because of our cookies. Our cookies come from the Cookie Cart, a nonprofit group in North Minneapolis. It's our way of giving back so generously to the community that donates to us. In addition, it saves lives. It's the only donation that comes out of your arm and not your wallet. The blood that saves lives is on the shelf already. And so what's not helpful is to wait to a disaster and then try to rush in and donate blood. It takes a full day or two to do all that screening we just talked about. So what we need is people donating regularly and in advance, and that way when the bridge collapses, we have plenty of blood.
Yeah, I remember that. You need all blood types as well. I'm B positive, but you need lots of other blood types as well.
So B positive is not only an attitude, it's a blood type.
Yeah. So it's easy to donate, and I understand that it's actually healthy for you when you donate too. Your body regenerates the blood.
Especially because we give you those good cookies. It does take a while to regenerate the iron, and so if you're donating more than 2 times a year, it's probably a good idea to take some supplemental iron. Donating platelets or plasma doesn't really take away any red cells, so it's mostly the red cell donations that benefit from replacing that iron.
And it doesn't take very long to do it either.
The actual donation of a unit of whole blood is about 10 minutes, but with all the questions and all the preparation and the setup time, allow yourself a good hour.
Now, Memorial Blood Centers, you're located in several locations. Why don't you tell us about those?
So about half of our blood comes from blood drives, where we go to schools, we go to businesses, we go to churches. About half is fixed sites, and we have fixed sites all over the Northland and throughout the Twin Cities, downtown, St. Paul, Plymouth, Plymouth, Eden Prairie, Bloomington, just to name a few.
And donors can be of all ages? Is there a minimum age, 18?
So 16 actually is the minimum age, and for 16-year-olds, we need parental permission. Once you're 17, you are a legally emancipated adult for the purpose of donating blood, and there is no upper age limit. I actually do some consulting for trying to improve blood supplies in international countries, and I was amazed to see countries like Kyrgyzstan and Kazakhstan having an upper age limit. And if you don't have enough blood on the shelf, why would you want to eliminate perfectly good blood donors? It makes no sense.
Other things that our viewers should know about blood donations, about viruses and infections like the Zika virus?
Sure. As far as blood donations, be aware that Memorial Blood Centers is the blood center that's providing the O-negative red cells that are on 14 different air ambulance helicopter sites. And so if there's a bad accident in the field, they can actually start transfusions even before they get to a trauma center like Hennepin County. But that means that especially if you're O-negative, that's truly life-saving. That's the universal donor where we can transfuse without even doing cross-match, which is helpful in the helicopter because you couldn't do a laboratory test in the helicopter. And so if you're O-negative, we really need those donations. As far as viruses, there's always emerging stuff, and whether or not it's practical to add a new test every time a new disease comes up is questionable. And so we're starting to look at pathogen inactivation. Are there ways of treating the blood so that it would pickle any new infectious agent? And in fact, we've done research studies with a number of companies, and most recently there is a pathogen inactivation technique for platelets and plasma. We're seeing right now whether that's something we should implement, given that Zika is in Puerto Rico. They will be implementing pathogen inactivation in Puerto Rico, however, where you have this endemic Zika infection. So that's a new development that we're very excited about.
That's very exciting to be able to have that option. Any other final comments for our viewers and how they can be a donor? What number should they call, or can they just show up at any of these locations?
Well, we certainly recommend you make an appointment to make sure that we're open when you come and that there's a available slot for you. However, just going on to our website, either on Innovative Blood Resources, which is just the merger of us and a blood center in Nebraska, or Memorial Blood Centers, and www.memorialbloodcenters.org will get you there. And right on the website is how to donate, and you click on there and you can make your appointment online for the location that's most convenient for you.
Well, Dr. Gorlin, it's been a pleasure to have you with us and great information.
Thank you so much.
Thank you. Still ahead, a health concern that you may not be aware of that you'll want to know about, so stay with us.
Something's not right.
My first symptoms were
constant tingling in my toes.
my legs, sometimes they'll go numb.
I had double vision.
They said you have multiple sclerosis.
Well, the beginning is the hardest time.
Kind of had to get a grasp on reality.
I had to adapt and change very rapidly.
I had to learn how to drive with my hands. Yeah, that was interesting.
I was a dancer. I don't see walking the way I walk any different than doing a dance. It just looks different. It's a different dance.
You see me have an off day, it doesn't take away from who I am.
A symptom may cause you not to be able to do that anymore. And at one point, I wasn't able to do any of those.
But I would exercise every day.
Since I've been cycling, it's definitely helped my walking.
To make a lot of changes in my life and just adapt to it.
I'm going to acknowledge its presence. I'm not going to discount it, but at the same time, I'm going to try my best to not let it stop me.
It's a fantastic opportunity to be working together with a common goal of curing MS, and sharing is the key.
Surprised to learn that millions of us experience a fall, especially at this time of the year, and we're pleased to have back with us Dr. Chad Trierweiler with Urgency Room. So thank you for being with us. And before we started the show, I was mentioning that I just had a friend of mine where his daughter, 46 years old, apparently was home alone and fell, hit her head, and she passed away. Very tragic. And so that's one extreme of the what can happen, but falls are very common. What are you seeing in the urgency room?
Yeah, this is a very popular time of the year. It's kind of hard to call it popular, but that's what we see is a lot of falls, often kind of that November, December range, and then now again into March and April.
And why this time of the year?
I think it's just people, when we know that it's cold and it's snowy outside, people are prepared for it. They've got their boots on, they're ready to go. But once things start to warm up, like this past week where it was 70 and now today it's only 30 again, that little bit of snow that melts, it creates that black ice, and people just simply aren't paying attention, and they walk right out the door with their either with their nice high heel shoes on or their non-slip soles, and they end up slipping and falling.
Or heeled boots. Yeah.
Right, exactly, and down they go, and I think they're just very surprised by it, but that's what facilities like ours are available for, to see you if you have a fall.
So what types of injuries do you usually see from the falls? What are the most common?
Sure, typically the central core is pretty well protected. Our reflexes reach out for that, but what does that mean? Hitting the head, reaching out, breaking a lot of wrists, and then otherwise stepping wrong or sliding and ending up breaking an ankle. And so I'd say there also, as we get a little older and the bones get a little more brittle, often hip fractures and pelvis fractures are common as well.
So when you have some of these injuries, how do you know when you should be seeking emergency care? When should you be going to the urgency room?
Right, and that's a question we get a lot of. I don't know whether this should be checked or not. I guess I'd start with head injuries because of all of the falls. I mean, we can fix bones, we can make those things better, but you only have one brain. It's still pretty tough to fix that if you suffer some type of a devastating injury. For the head, a few high-risk things. First of all, we would want to know what type of a mechanism was it? Are you falling off of a ladder or just a slip, on one or two steps? Where did you hit your head? More in the front or the back? The side areas are the weakest areas where the bone is the thinnest, and you're more likely to suffer significant injury. And then from there, how did you feel afterward? If you've witnessed your loved one suffering a fall, was there a loss of consciousness, or was it just that brief moment of seeing stars, or was your loved one completely out for 2 minutes? Once they do come to, do they remember the event, or are they more confused? And then the big ones that we look for, without a doubt, is once you get bleeding inside your head, there's no room for that blood to go. So it just starts to expand and expand. It puts pressure on the brain, and when that pressure gets placed, you start to get really sick to your stomach. Anyone who vomits more than once after hitting their head needs to be scanned. Also, they'll get more confused. They can get very sleepy. And so any of these mental status changes where your loved one just doesn't seem to be acting right after they hit their head, that would be absolutely a prime time to take them directly to a facility like ours, or even to consider calling 911, especially if they're certainly off of their baseline.
And the injuries you were saying can vary depending on where you hit. And can you kind of talk about some of the type of the injuries that they incur if they're hit in the back, the top, on the side?
Sure, of course.
Like
I remember having a smart teacher growing up discussing how the face was made to be a perfect crumple zone, where if you get hit in the forehead, you get hit in the face. Yes, you suffer a lot of trauma to your lips and your teeth and your nose, but it really protects the brain. And so frontal injuries are actually the safest ones. On the flip side of the coin, hitting the back of the head, again, the bone's pretty thick there. Most of the devastating cases we hear of are those where they fall and they hit it right over the temple or the side of the head. Just the bone is thin. There are a lot of major arteries that run right along those temple areas, and so a fracture there can certainly cause bleeding and cause devastating situations like you were discussing with your friend's family.
Yeah, it seems like every year we hear of a couple of people that are even on the snowboarding or skiing, again hitting their head, telling everyone they're fine, but then an hour or less later, they're very sick.
Sure. So. And the important thing with skiing, with snowboarding, with hockey, fortunately, most people are getting the message how important it is to wear a helmet. Wearing that helmet gives that extra bit of cushion, so that way, instead of the brain slamming into the skull, it has just that little more give, that slowing down mechanism, so that way you don't suffer a brain bleed. Now, keep in mind, you can still suffer concussions and have issues with that as well. But again, those are rarely life-threatening, and it's those bleeds that really get you in trouble.
And concussions, it's not something that shows up on a scan at all, right? For the most part.
That's correct, and I'd say that's probably the vast majority of what we see. A mother sees their child fall, and they just want to make sure that they're okay. They may be a little nauseous. They may just be not quite firing on all cylinders, and they come in to see us. And the great part about the urgency room is that you have board-certified emergency doctors there to look over these children and determine who needs that CAT scan and who doesn't. And once you've gone through the CAT scan, if we make sure everything looks clear, then we can give guidance of concussion injury, of making sure you don't hit your head a second time, avoiding doing a lot of high-energy sports or other chances where you could suffer a second concussion, and then discuss ways we can get through that as quickly as possible and set up follow-up.
Because it's those multiple hits that can cause severe damage, right?
Oh, without a doubt, yes. We call it second hit syndrome, that a single concussion is rarely anything too serious, that most of the time you will completely recover from that. It's rare to suffer any IQ points being lost or anything there, but certainly if you get a second hit, a second concussion right where the prior one was, that brain tissue is, it's susceptible to having more serious injury, and you can come out of that with long-term hearing issues, long-term balance issues, cognitive issues where you just may not get back to your baseline, and that's why we are very adamant about making sure we stay away from those secondary chances of getting hit with other contact sports.
So, and I understand too, the older we get, the more likely we are to experience a fall?
Well, of course, yes. You watch. Yes, I have small ones at home, kids, and it's just amazing how quick their reflexes are. It makes me feel very old that you start to tip over. A lot of that just is a slowing of the reflexes, a slowing of the brain power. But more than that, as we get older, we often become less conditioned as well, and so our hips are not as strong, our cores are not as strong to grab out and catch something to stop us from falling. And so certainly as we get into the elderly ages, yes, we see a lot more falls there where they just aren't able to catch themselves.
So would exercise, especially exercise in the core part of your body, would that help to prevent some of these falls?
Oh, absolutely. Absolutely. That just we remind people consistently just to get up and keep moving. That once you become so sedentary and you sit and sit and sit, all of those core muscles just become weaker. They simply don't have the strength to help you respond. And so any type of a physical fitness exercise program, much less just simply going for a walk and strengthening those muscles, can be very helpful.
But be careful where you're walking.
Of course, exactly. This time of year especially. Yes.
Other tips or advice for our viewers on preventing falls, seeking treatment, things like that?
Sure. Just being cognizant of what the weather conditions are and what it is that you're wearing that day, and just being aware that this time of year you just have to be extra careful. But beyond that, it's just being smart. It's Minnesota, right? And so the fall and the winter happens, the freeze and the thaw happens, and just being cognizant of the weather condition outdoors.
I just think people would be really surprised to hear that you're at a higher risk at this time of year than maybe some other months and things
January
like that.
or February, absolutely.
And preventing, always try to keep moving, things like that?
Sure, just strengthen the body. It's the only one that you have, right? And so just sitting all day long will not help you when you are actually up and moving. So anytime you can strengthen that core, strengthen those legs, just allows you to be better prepared for any falls.
And as we were talking before the show started, aside from, to change the topic just a little bit,
sure,
that we're seeing a late insurgence of flus. It's typically more during the holidays to the first of the year, but I'm hearing a lot of people suffering from different viruses and flus and stuff. What are you seeing in the urgency room?
Yeah, the CDC did a great job this year setting up the flu vaccine to make sure everyone was covered. So with those of you who got flu shots, we're seeing a much lower incidence of flu this year compared to last year. However, yes, the Minnesota Department of Health just put out last week that we've gone from sparse cases of flu to now widespread here in Minnesota. And boy, have we seen it. I was at the urgency room all weekend long, and I think, what of the 70 or 80 patients I saw, 6 or 7 had the flu, true positive cases, and we treated a number of other ones presumptively, saying we're anticipating that's the case. And so it is definitely out there. Influenza B is the one that we're seeing a lot of currently. There's an A and a B strain. The A was well covered by the shot. The B strain often comes a little later, not as covered as well with the shot, and so, but we're seeing many people with that now.
How about who's it affecting mostly? But what type of the population that's being affected by it.
Yeah, that's the challenge, is that the flu doesn't care how young you are or how old you are. We're seeing it a lot in office workers, people who are around, their same age group. I'd say between 20 and 60. I've seen a couple college students recently with it, but the challenge is that they bring it home then, and then they pass it around to everyone else in the house. It's just a very contagious virus, but fortunately the strain this year is not quite as strong, not causing as many problems.
And those symptoms that you're seeing, and
typically sudden onset of just all of a sudden feeling like you've been hit by a truck. Oh my gosh, my neck hurts, my shoulders hurt, my back hurts, a temperature suddenly comes right after that, and feeling that shaking, cold chills that can happen. Often people will have respiratory symptoms, a runny nose, a cough, but those are nowhere near as bad as just feeling so cold and hurting all over the body. And often the best treatment is what Mom probably taught you, a little tender loving care, a little soup, ibuprofen, lots of fluids, and rest, and staying home. And it takes at least 5 to 7 days before that virus gets completely out of the system. So most people are out of work for a little while.
And when should they go to the emergency room with flu-like symptoms?
So I guess the biggest issue would be if you have other comorbidities. You're certainly elderly or very young, under 6 months of age. If you've got already an issue with heart problems or lung problems where those areas can get compromised easily. If you're so weak that you're not able to get to and from the bathroom, to and from the kitchen, not able to drink the fluids that you need to catch up, those are the very high-risk folks. Now, across the board, most 20-year-olds, 40-year-olds, 60-year-olds are going to fly through the flu. They're going to have a rough week, but most of them will be fine.
Are you seeing along the same lines an increase in pneumonia right now as well, especially among the elderly?
Sure, it's this time of year, of course, right? For pneumonia, and certainly all of the other upper respiratory viruses going through can wreak havoc on the lungs and get you set up to be more likely to develop a pneumonia. But sure, pneumonia we see year-round, we really do, because it's always out there. But certainly as we are stuck indoors and passing these both viruses and bacteria around, we're seeing a lot of pneumonia too. Sure.
Final tips and advice on treating, preventing the
Sure.
flu?
It's easy to say, hard to do when you're coughing. Trying to get into your arm, into your hands, washing them regularly. And I guess the biggest thing is that if you feel that sick, that you just feel absolutely run down and awful, we all think we can tough through it and we're going to go to work, but actually you're harming your fellow coworkers more than just staying home that extra day and recovering. So.
All right. And if someone wants some information about the urgency room or where you're located or
absolutely.
to make an appointment?
We have 3 freestanding emergency facilities, one in Woodbury, one in Vadnais Heights, and one in Eagan. We are open 365 days of the year from 8 in the morning until 10 at night, and we are able to see you for literally anything that might be causing you problems. So come on by.
Well, Dr. Trierweiler, great to see you again. Thank you for coming back.
It was
Always
my
good
pleasure.
information.
Yeah, thank you.
And we'd like to thank you for joining us. We hope we'll see you back here on Inside Healthcare next month. See you then, everyone.